two types of sciatica. So there's true sciatica, which is a condition or injury that directly affects the sciatic nerve itself. And there are sciatica-like conditions, which most people really have, which is conditions that feel like sciatica, but happen to other reasons that affect the sciatic nerve or the nerves that bundle into it. So these are some common causes in the body. Herniated discs. So the discs create a space in your spine. If we have a herniated disc, one, there's not enough space in the spine, and two, that can cause pressure on the nerve itself, exiting what we call the IVF, the foramen where the nerves exit. Bone spurs, so that's just overgrowth of a bone due to an injury. That can cause an overgrowth again, where the nerve exits. And then muscle tension, as we talked about, if there's an imbalance in the spine and the structures, the muscles get tight, some get weak. And most importantly, the piriformis, which is that muscle that we saw go over, that big muscle that goes right over the sciatic nerve and the bundle that leads up to that. But that gets tight, that can cause really big sciatic pain. It's called piriformis syndrome, and then we work on that a lot too. So the sciatic nerve, as you can see, comes from all the low back through the sacrum and works its way down the leg under the foot. And spinal stenosis, again, just kind of a visual representation of the spinal cord collapsing or narrowing. Sometimes the nerve goes under the muscle. Sometimes the nerve actually winds through the muscle. So that's why if that gets tight, that could really cause some piriformis-like syndrome. So we want to make sure we clear that muscle up and make sure the surrounding structures are good. And then degeneration and herniated discs, the same kind of thing. We lose space in that disc. Things get collapsed. We don't have as much motion. So we need to work on opening all of that up. So what can we do about it? Most importantly, chiropractic treatment. As I said, we can get things moving, get the spine manipulated, restore proper alignment, reducing inflammation, taking the pressure off the nerves. We also combine our therapy with massage. As we get adjusted, we relax the muscles, relax the structures, get everything moving. And as you know, we work with red light therapy at Vitality, and we recommend heat and ice to accelerate heating and provide comfort.
So what does red light do for this?
Helps calm down inflammation and helps relax the muscles. So it won't do anything with the structure, but because when you have a sciatica flare-up, your nerves are inflamed and all the muscles around are really just tight protecting. So it just helps those structures calm down and relax. So it helps any inflammation of the nerves and then the muscles relax around that. So here's an x-ray I want to show you of how chiropractic can help. This is a patient I had with really low back pain and had some sciatica going down, not all the way to the foot, but down to the calf and knee. So this is the first picture we took. We see there's a little bit of twist in the hips. Whereas this is a year later, we can see we moved the hips from 5.5 to 3.5 millimeters, and the spine is just so much better. It's straight all the way up, and then a little bit higher, it veers off at 2-degree mark. So it's just kind of a really good example I wanted to show of how treatment and care can start to affect the structures, take the pressure off the nerve, and kind of relax the whole body.